Now add Kemptville District Hospital to the list, which is south of Ottawa. It will close its ER from 7 p.m. to 7 a.m. for 6 nights until Tuesday morning. According to the Ministry of Health, there were a total of 21 overnight ER closures during the 2 weeks prior to this one.
For care. 6 ERs in Quebec, including one in Montreal, temporarily closed in July, and there were closures and reductions in Alberta, Saskatchewan, Nova Scotia, Newfoundland and Labrador, and all 3 territories. On the West Coast, Ashcroft, BC's emergency room has closed continuously, and 2 residents who live nearby died. Kamloops, about an hour away, is the nearest medical facility.
So this is basically what you'd be greeted with, right?
Yes. This means that anybody who comes to the Emerge for Care will not get it.
It's 5 p.m. This tiny hospital in Chesley, Ontario is closing its emergency room for the night.
This is the wrong time to be learning this, to be showing up at the ER.
Yes. If it's urgent, then we call an ambulance for them, or they call an ambulance.
So they would get to the ER and then have to call an ambulance?
Yes.
To come here and take them to another hospital?
Yeah.
We've always had a public health care system in the province of Ontario, and we will continue to. Are we looking at options? Absolutely. There are jurisdictions in other parts of Canada, in the world, that have other opportunities that we're going to look at. And all of those suggestions are being considered and studied.
Hey everyone, welcome to today's View. My name is Elton.
My name is Amrinder.
Yeah, how was the long weekend there, Labor Day weekend?
It was good. It was good. Took the kids out to the CNE. And oh man, it's gotten quite expensive from from last time I went.
Yeah.
I think they're trying to make up the revenue from the last few years, right?
Yeah,
so,
how much do you think you spend there?
Oh man, I think close to $300-400. Took my kids and my nephews, so about $400 or $500 we've spent, and that's an average family. So, but how was yours?
That was all right, but not as expensive as yours, but. Can't complain to this guy here who's willing to spend $5,000 for a family doctor out in Vancouver.
Oh, I heard about that.
Yeah, so it seems like things are not working out in the healthcare field there. There's a clip out there explaining why he wanted to spend $5,000 trying to find a personal doctor. So let's just play that and see his reasoning for it.
Okay, let's hear it.
I mean, I placed the ad because I need a family doctor.
It's that simple for Gary Schuster, who suffers from a metabolic disorder so rare he carries around these information cards about the disease should he fall ill.
Emergency room doctors typically have no or little experience with fatty acid oxidation disorders.
His condition, CPT2 deficiency, needs consistent monitoring, something that disappeared when his family doctor retired. Efforts to find a new doctor have so far led to long wait lists. So he placed this ad offering $5,000 to anyone who can help him find a suitable family doctor near his home in downtown Vancouver.
Need someone who's capable of tracking the disease, understanding it. Typically, if I have to see a doctor I'm not familiar with, the first 10 minutes of that session is explaining what the disease is.
An estimated 1 million British Columbians are without a family doctor. Last week, the province announced $118 million in stopgap funding to support the sector, while a new fee structure is negotiated with physicians. But that won't help Schuster find the help he needs now.
This is truly sad, but again, indicative of how bad the healthcare crisis is on the ground. I hope one of my colleagues can, and I'm sure they will, someone will try to make room for him. Nobody should ever have to put an ad in the paper.
As a dual Canadian U.S. citizen, Schuster's considered buying private health insurance across the border and finding a doctor in Washington state.
We know the battle ahead will be long.
But he believes in public health care. Even fought for it while living in California before moving to Vancouver after Donald Trump became president.
I actively worked on the Obama campaign in 2008 precisely because he was promising to deliver a Canadian-like system.
So it's not lost on Schuster how his $5,000 incentive undermines the very system he believes in.
I think it's terrible that I'm able to do that and others can't. It's unfair. It's not how the system was supposed to be built. But at the same time, I have young kids, and if something were to happen to me, it would really be a disaster for them.
As of Wednesday afternoon, 2 people who don't want payment had responded to the ad. Karen Larson, CBC News, Vancouver.
Yeah, lots of things to unpack there with him.
Yeah, so it's, I'm glad two people, responded to him, and hopefully he can find a family doctor. It seems like he has special disorder, obviously, it doesn't apply to an average Canadian. But it's very interesting that he's one of those guys that moved here since Donald Trump came into power, and he moved over.
So I think that speaks to volumes about privatization of healthcare and then public healthcare.
Yeah.
Especially with his type of disease, it sounded like it was going to be an expensive thing to take care of.
Yeah. I mean, I don't blame him. There's a lot of Americans who said they would, they would leave when Donald Trump became president, and a lot of people did, and he's one of them, and it's interesting. So he is a dual citizen.
Yeah.
So he did advocate with the Obama campaign to bring in, healthcare to copy or mimic the Canadian system, and now he's having trouble himself with the Canadian healthcare system.
And it's interesting, they said close to 1 million in BC don't have family doctors.
Yeah, which is a quarter of the population. So that's where it's interesting, I think, and that's overall in Canada, there's about 5 million Canadians who don't have a family doctor.
Right, and it's crazy to think that we don't have family doctors to take care of the population, and this is what's stressing out our ER systems: the lack of doctors, personal family doctors, the lack of nurses.
Agreed. And I think this is how the hierarchy starts. I think, it starts with the doctors not having a family doctor, because what happens if your kid gets sick or you get sick, if you have a family doctor, you can go to them, and most of the time that is your visit. You get the prescription, you go to the pharmacist, you get the drug, and then that takes care of most of the problems, right? You don't go into the ER. Now, what happens if you don't have a family doctor?
Right. And it looks like that's what's happening here. We don't have doctors to go to, and then we're forced to go to ERs to diagnose a simple thing that a family doctor could have taken care of.
I mean, there are walk-in clinic options, but I hate them. I personally have gone to a few of them, and the reason I hate them is because you get a doctor who doesn't know you, who doesn't know your history.
Right.
And then other than giving you maybe Tylenol or Advil, they don't really do much. And I understand why. They don't want to take on the liability. God forbid they give you a medication that, they don't know your history or whatnot, and you can't explain that within a few minutes to a doctor. So they don't want to give you a specific medication unless you go to them over and over again. And then,
for sure.
So I understand that point of view. But the challenge here is because we don't have enough family doctors, I think it's causing an overload on the healthcare system. It's causing longer wait times in ER. It's causing which is in effect, there's always a shortage. So we have a shortage of doctors, we have a shortage of nurses, and then it affects. It's a ripple effect that affects EMS and other services as well. So
it's definitely a cascading effect. And the problem right now is, even over the Labor Day weekend, we had closures of ERs just because they had a lack of staff. And some of the ERs that were mentioned on the news was Newfoundland had 8 ER places closed down.
Wow.
And just in Ottawa, or south of Ottawa, there were 2 small cities that had to close ERs. Now, that might not seem like a big thing for certain people, like maybe the small towns close their ERs because they're not getting anything. But let's say they do get something. Those patients now have to go to major cities to get treated, right?
And this is where EMS has traveled further. So, instead of 10, 15-minute drive or, 20-minute drive, now it's turning into an hour drive or longer. And then when they get to the ER, they have to offload. And because there's a nurse shortage, they have to then wait until that transfer care is done, and then they can relieve. So it's causing a huge shortage in EMS as well.
Oh yeah, and there was a clip about it. CBC was doing like a short documentary with the Ottawa EMS. And it was pretty shocking. During their interview, there was a moment where they didn't have enough ambulances. And, we have a clip out there.
Yeah.
We'll just play that for a bit.
Let's play that.
Yeah.
Inside Ottawa's 911 nerve center,
At a moment no one wants to ever happen.
We're at level 0 right now.
Level 0,
That's right.
which literally means 0 ambulances.
That are available to transport someone to the hospital.
So yeah, that's the clip right there. It's crazy. Level 0 basically means that there's no ambulances available.
Yeah, for the city of Ottawa, the capital of Canada, didn't have enough ambulances, which speaks to a lot of things there.
Yeah.
Now, we only played a short amount of that clip there, but it explains why they were short on EMS. Problem being is they were not able to offload their patients because there's not enough nurses to take care and triage this. Right. And, why are we getting all this shortage of staff with nurses and doctors?
Just to kind of give you some data, I have a graph here, and it shows how many RNs employed in direct care per 100,000, population. So the lowest, even though Ontario has the most dense population, it has the most population. Ontario has the lowest, 609 nurses per 100,000 people. Second lowest is BC, 650 nurses per 100,000.
Right.
And the most, what do you think that is? And just to compare, Newfoundland has 982 nurses per 100,000. Elton, why do you think? There's less nurses in Ontario and BC, where we have majority of the population than in obviously there's a shortage everywhere, but just to kind of compare, why do you think there's a shortage in Ontario specifically?
I think a few things pop in my head for that is it could be the nurses are going to the private sector. And we're not getting data on that part.
There's some clinics,
right? Or the other part is maybe the cost of living is too expensive in the big cities nowadays, right?
I agree. The population, population obviously is one thing, but obviously wherever there's a dense population, the real estate is always so expensive, and that's where it comes out. Ontario and BC, housing prices are so expensive. Where a nurse says, I'm making 50, 60K to start. That is not. I need to save up maybe 20, 30 years before I can even put a down payment on a house. That's what it's coming down to.
And I think, maybe we're going off topic, but cost of living is going up, but we capped the nurses' pay, I think Doug Ford, I think it was 1% over every year the pay goes.
So what they said, they have a Bill 124, which limits the pay to 1% per year for nurses and teachers. So it exempts, fire, police, and other sectors, but they're saying that it's 1%.
It's crazy because if you were a new nurse just joining in, and you're starting off with obviously probationary pay or low pay, and it just your next increase goes up by 1%. That's not a lot.
I mean, inflation it's at 7.6.
Right.
Why is it that they're capped at 1%, especially on fields that we need, especially nursing? It makes no sense, especially where we're short on nurses. It doesn't make sense to limit their pay by per percent. It should be based on performance. Anywhere from 1% to 5%, whatever. Right. But it shouldn't be capped at that. And
the other problem is, if we're capping pay, how are we going to attract foreign nurses to come into this province or this country and say, work for us. This is what we're offering you. Especially in Ontario, there's probably going to be nurses that are saying, I don't want to work in Ontario. I'll probably go to Newfoundland or something else.
And there is a burnout effect, obviously, because whenever you're in a dense populated area, whether it be, city of Ottawa, city of Toronto, anywhere there's always the hospitals are consistently busy. Right. Versus if you're a little bit out of town, a little bit out of the way, where the surge happens, let's say during certain times, it's like having a restaurant where you're consistently busy. It doesn't slow down. So I found a video about the Bill 124. I just want to play for you guys. Okay, give me a second here.
Ontario nurses have been on the front line fighting COVID-19 for months now, but many today spent the day marching to Queen's Park, rallying against Bill 124. The legislation passed late last year caps wage increases for some public sector workers, including nurses. Workers say it's unfair, gender-based wage discrimination.
we're here to protest Bill 124. So Bill 124 is supposed to be for fiscal responsibility for the province by cutting or capping wages by 1% increase for the next 3 years. The problem with this bill is that it actually exempts municipalities, police, fire, and MPP, surprisingly, they got a raise before the bill was even passed. It's essentially sexist because it only really encompasses nurses and teachers.
Just bury that.
So, as you heard from there, it's funny how the politicians always get the raises.
They always do.
Their raises never stop.
Mm-hmm.
But yeah, it's I feel for them. I feel for the nurses. Definitely. I mean, this was from back in November 15th, 2021. So end of last year. But it's an issue that the nurses feel like they're not treated or they're not getting the fair share. So if that happens. Why do you think they're going to want to stay in this field? And that's where a lot of them are leaving. A lot of them are leaving.
And
the
this
field.
is what's causing our long wait lines in ERs, and then we're having these ER closures because we don't have the staff.
Yep.
It's a cascading effect. Like you said, it's a ripple effect when certain things don't happen a certain way. So if you don't have the personal doctors, everyone goes to ER. You don't have enough nurses, then we can't triage enough patients, and we don't have enough beds. And then we have this hallway treatment, as in the beds are in the hallways. It's just people waiting. It's a lot of things to digest here, and we need to make sure that people are taken care of. Just getting ERs closed is not a good thing because you can't treat the patient. And
agreed.
It's unfortunate.
It's we're getting a lot of ERs closed in small towns that you hear about, but even east of Ontario, Ajax or there was an ICU closed for a month or longer, where patients were directed to Ajax, Pickering, and Oshawa hospitals. So this is a big issue, and it kind of has a ripple effect. So if you close one section, then population has to go to the other, and it becomes a big hassle for the hospitals to handle.
Right, because a hospital is built for a certain population in mind, and now you're bringing, I don't want to say outsiders, but they're out of towners, and if they are not getting the care in their own town, and they're coming to, let's say Pickering, they're going to Oshawa, whatever the case might be, you're overloading the beds in the other town now. So, we need to make sure that staffing. There's no staffing shortage across most of the hospitals there.
And some hospitals, a perfect example is the Brampton and Civic Hospital. It's in general, based on the population, I think in that area, we definitely need 2 or more hospitals.
Right.
And what's happens is, obviously, it has a reputation for one of the worst hospitals in GTA. So what people do is, yes, they'll go to Etobicoke, they'll go to Georgetown, they'll go to further hospitals, Oakville, Milton, and that causes more pressure on the hospitals, especially for kids. I know a lot of people from anywhere in the GTA go to sick kids. I personally would take my kids there in a heartbeat. But it causes a lot of pressure on the hospital. So definitely, along with staff shortages, we also need to consider, where we have a large amount of population. We don't we're looking for donations for the Brampton Civic Hospital. They told everybody, this is a secondary hospital. We're not going to close the older one. What do? As soon as they fired up Brampton Civic Hospital, they closed down the other one. So I know it's opened as another health facility now. It's not a hospital, but I think we definitely need another hospital in Brampton, like ASAP, or should have had it as of a decade ago. So there's those problems.
I mean, this is where the lack of planning and foresight doesn't come in either from the politicians.
Agreed.
They know that the city's expanding, or other cities are growing as well, and we need to take care of things. But you cannot just keep prolonging things and be like, we'll take care of it next election term. or whatnot,
next term, if I'm around, right?
Right. So that's the crazy part there.
Yeah. And I mean, what do you think? What do you think some of the solutions are? What can we do to, let's say if you were a politician, what would you do? It's easy to point fingers at politicians and say, hey, you're not doing a good job. But what would you do if you were in power? Like, what were some of the things we can do as Canadians?
Well, right now, what we're doing is we're lacking bringing in the foreign trained doctors and nurses right now. And unfortunately, they have long wait lines that is actually too much of a wait time.
Agreed. We have a lot of doctors, a lot of nurses who come from other countries, and we give them even PRs based on that. Hey, you're a skilled person, come over, and But did you know that currently there's about more than 13,000 international trained doctors who are not working as doctors? So. And 40% of them not even in the healthcare business. They're driving a taxi, driving a truck, whatever the case may be, working in a factory. So it's, and Canada ranks about 26th in the world in terms of physician to patient ratio. It's about 2.8 doctors per 1,000 people.
Yeah,
2.8.
And the thing is, when we bring them here on false promises that you'll get hired immediately, some of them are still going for classes. They're doing courses again that they've already passed out in their home countries, and I can understand some people will say maybe they forged their licenses or something. But this is where you test them. You test them, you let them do residency for a few months, see if they're actually up to date on what they're doing, because medical terms are not that different around the world. Right?
Yeah, I mean, have the nurses and doctors, have them fast track into testing. It should be taking weeks, maximum months, and then from there you can put them under a physician or a nurse, and then they, within 3 months, 6 months, they do residency. It could be like probation, how employers have probation. Within 3 or 6 months, if they don't think they're fit, or they don't qualify, or they don't have the expertise to be in this field, then we should be able to, say, no, you're not ready yet. Go back to study more, or you're good enough, and then you qualify, and then you start practicing, right?
Yeah, because right now the problem is, there's not enough doctors and nurses being trained in Canada. There's like, I know for nurses or doctors, there's like a double-digit wait line.
Yeah, very
right?
very
like,
limited seating.
Just to do classes.
Yeah,
right.
I agree.
1 year is like 15, 20, and then there's only entrance exam once a year.
Yeah.
It defeats the purpose of, are we planning for the amount of people we're going to bring into Canada?
Yeah.
Are we planning enough for the babies that are being born?
Yeah.
And they're going to retire?
And the baby boomers, right, that are retiring soon. Here's a video that I want to play for you guys. Listen to this.
Motherhood isn't the reason Dr. Saida Azam hasn't been able to work as a family physician during the pandemic.
I really felt bad that I couldn't participate actively.
Instead, she says it's that her years of training and experience come from India and Oman. Certifications, she says, that are basically meaningless in Canada, where it's not possible to simply transfer your skills.
Comparing to countries like US and UK, the process is a little bit lengthier.
Time-consuming, confusing, and costly too, says Dr. Shafi Bhuyan, a professor at the University of Toronto, who came to Canada more than 10 years ago.
This is not only doctor problem, also nurse, midwife, microbiologist, dentist, all sorts of population.
With staffing shortages derailing hospitals across the country and 5 million Canadians unable to secure a primary care physician, Bhuyan says the solution is to invest in foreign-trained doctors.
So as you can see from there, there's doctors that are ready and they wanted to help during COVID, and they could have gotten involved had the process, been much more efficient, right? So we need to improve it.
And like in her case, can't speak to everything what's going on with her, but if she was brought here because she's a doctor, because it's very hard to immigrate to Canada unless, and I know some people will have issues with immigration in Canada as usual, like there's always two sides to everything. But me, myself, when I had to go through the immigration process, I know people had to list what they're studying for and what they are, and the higher points you score, the better chances of you emigrating. So if you're willing to poach doctors from different countries and make them settle here, why not fast track the process instead of making them do a test and go through classes, and that might be a year or 2 year process. Why can't we fast track this? Why can't we greenlist the countries that we can trust? If the thinking is that there might be fake degrees out there or fake doctors, you know,
like right now, I know we've been talking about this for quite a few months and maybe over a year longer, where we had, we recommended when I spoke to you last time is this where we can fast track, and it appears on September 7th, there's an article on Global News. It says Ontario gives okay for nursing college to expedite international nurse registration. So at this point, I think they are going to do this, but why this late, and why can't we do this for doctors as well? So
Right.
we're panicking. We're going to the College of Nurses of Ontario, and we're saying, hey, we need help. What can you do? And then they're coming up with they've been trying to say, hey, we've been trying to get this for the longest time. They're going to find a way to fast track some of these nurses, foreign nurses. But why can't we do that with doctors? Why haven't we done this? I mean, with doctors for over a few decades now. We've been shortage on doctors for quite a few decades now, and why are we not doing more? Is my question. So you're right. It's not a proactive approach. It's more a reactive approach. Every time we're reactive, and that's the problem.
and it's not only us in the cities out here in Ontario and BC that's having issues. Even the Indigenous people up north, they're having issues with healthcare as well. They don't have, the proper nurses, doctors. They don't even have the facilities. Sometimes they got to travel a day or two, maybe less, depending where their settlements are. But again, it's not like it's a new issue that just
popped
happened.
Up. Exactly.
Right?
Exactly.
COVID made it worse, obviously. But this is where, I fault the politicians, and partly as us as well, because we don't hold the politicians accountable, right? We turn a blind eye to everything and say, oh, well, it doesn't affect me, so why should I care about this, right?
Agreed.
And now we're facing the wrath of the situation where, people are not getting the proper healthcare that they need. This man has to spend $5,000 for something that he shouldn't, for a personal doctor. Like, even Ontario, we are having a shortage of personal doctors, right?
So let's not even go that far. Let's talk about ourselves. Do you have a family doctor?
I don't, but my dad does. And,
and why don't you?
Well, when I tried to join my dad's personal doctor, again, this was when I was younger. I felt like I didn't need a personal doctor, right?
Yeah. And this is where, when you're young, you feel like it's not your problem.
Exactly.
Yet, right?
Yeah.
So, now we're in our 30s and whatnot, and especially I have kids and I want a family doctor. So I don't have a family doctor. I had a really good family doctor, which took a long time for me to find. I had really bad experiences in the past. I finally found a good family doctor. Unfortunately, he passed away.
Right.
And now I don't have a family doctor for the last few years. I'm looking for one, but it seems like by the time I find a good family doctor, somebody's recommended me, a family or friend, they have a wait list. They're not accepting new patients. So I think, and in places like PEI, from what I've heard, people are on average waiting 4 to 8 years for a family doctor. And they're saying, now we have to take our kids or whoever, we have to go to the ER.
Right.
And so I think, just speaking volume, I think a lot of people need a family doctor, and I think that will stop a lot of people from going into ER. And the other challenge to that is, yes, you have a family. Let's say you are one of those lucky people that have a good family doctor and you're happy with them.
Yeah.
Getting a specialist appointment for anything. So whether you need an MRI, I know a family member who had later found out that he had a brain tumor. He had to wait almost a year for an MRI. Which is unacceptable.
Yeah.
Especially being a first world country. I think it's unacceptable. So why does it take that long? It shouldn't take that long. Like MRI should be, okay, here's one in the next few days, 2 weeks, I understand. But it should not take months or a year to schedule an MRI appointment.
Right.
And that's a big issue. And same thing with the specialists. So we have specialists and, just in doctors in general, we're having a a hard time retaining and keeping doctors in Canada, and then a specialist just adds volume to that.
Right.
And then so this family member had to wait, let's say, a year for an MRI and another year for surgery. Now, God forbid, this guy was in his early 30s. God forbid something happens earlier. Something happens. Then what? A lot of people end up dying or getting worse, obviously, waiting for these specialist appointments, waiting for these MRIs, waiting for these CT scans. It shouldn't take that long. It takes a long time.
No, and lack of family doctors. If you don't have someone to go to, and this is causing people to go to ERs, right?
Yeah.
That's causing people to overload the system when they don't need to.
Yep.
Right.
Agreed.
And this is where I think they were talking about also having pharmacists fill out prescriptions or help out with certain things.
Yeah, that's the government solution is as of January next year.
Yeah.
Apparently it's implemented January 2023. Pharmacists will be able to prescribe drugs. So obviously there's a limitation to certain drugs and everything. But there are certain drugs that they can, you can go to your pharmacist and pretty much get some of those. Now, the good side to that is, yes, it reduces trips to ERs or for people who don't have family doctors. It reduces even trips to the family doc, because if you need something, that you have to just go to your doctor, just exactly what you need, or your doctor knows exactly what you need on a regular basis. Why do you need to go to your doctor every few weeks or months to get that, right?
Yeah.
So it reduces, obviously wait times and lineups at your family doctor and even walk-in clinics. So you get your medication faster.
Right.
Takes the pressure off the hospital, off the nurses, off the doctors, obviously EMS and everybody. So that's a good point. But what do you think are the cons to this? What do you think,
Yeah, so, for me, I feel like if we were to go down this road, pharmacies have to make money, right?
That's what their ultimate goal is, yeah.
Right? They can say they're for healthcare, which is true. They are prescribing drugs for us and whatnot. I mean, they're dispensing drugs for us. The downside I see to this one is there are companies that will pay the pharmacists to sell their brands.
One drug over another. Yeah.
Exactly, right? And, it might not be costing us much because we do have healthcare subsidized for us.
Yep.
But then it does cost the government money,
Taxpayers,
which is us in the end paying for this.
Yep.
And I remember seeing a CBC documentary a long time ago, maybe 4 or 5 years ago, where they went to
2018.
where they went to Costco and they were able to see what was going on. Basically, they had someone going in acting as a drug maker, and Costco was basically demanding a lot of money to make sure that that drug would be upfront
available in the pharmacy, right?
Or available,
kickbacks,
basically kickbacks to say that, hey, I will promote your drug over this drug and whatnot, right? So
yeah, how do you prevent they're essentially shopkeepers. How do you prevent shopkeepers from?
And this is the problem, right? And I'm not trying to say all pharmacists are bad.
No.
But in the end, we are people that do stuff for money, right? In the end, we got to take care of ourselves. We got to take care of families. We got to put roof over our heads. Money does talk, unfortunately, right? But at the same time, if we were to go down this road of pharmacists doing this, we need to have a government that's able to monitor this. But I don't think the government will be able to monitor this.
Yeah, the question is who's going to watch the pharmacies?
Right?
Yeah, exactly.
Because right now the government has failed us in so many things, and just adding another list for them to take care of will not help the situation.
Agreed. So other than planning ahead, being proactive and all of that, we talked about obviously expediting foreign doctors and nurses from joining our healthcare system. What are your thoughts on, obviously this is a big topic these days, it's in the news, is privatization of the Canadian healthcare system. What are your thoughts on that?
Well, I'll be honest with you, I don't think privatization can help us.
Why not?
If you look at the States right now, they are somewhat private. They are privatized, and they are somewhat, with the Obamacare, they do have some
Medicare,
things there. But again, with privatization, it's money talks, and whoever has the most money can be helped out, right? And in the end, it always affects the lower class people or the low wage earners. If you see, like, if one of the workers at Tim Hortons. You know, they're not getting paid a lot, and if they were to go for privatized healthcare, they would not be able to afford it. So it's a lot of things that's affecting people here, you know, like, and then with America, if you see how people get their healthcare, they basically go job hunting with obviously good pay, but also whatever the healthcare benefits are, right? So you're always stuck to that job. You cannot just leave your job and go to another job and be like, I'm okay.
Yeah.
You always look for that healthcare. So
yeah.
I know you probably might have a different view, but I feel like the low wage earners in this country will definitely lose out on this healthcare.
No, good point. I think instead of full, from my understanding, the way I look at it is you know, America is mostly privatized, and there's a lot of lobbying going on in the government and everything from these, you know, and there's a very little, you know, public healthcare. Whereas here, I think it's obviously just public right now, but I think if the systems work in parallel, where, you know, we have half and half. I mean, we prefer perfect world.
Yeah.
We have half and half where we have public, we have private. I think some of the things it can do is obviously offload the stress from government-funded hospitals and facilities, so less wait times, and you can see specialists and whatnot. Because, you know, right now, we know that the system isn't working. Either we need a revamp or we need to introduce something. So my thought is if we can have a parallel system where we can kind of have a competition, because some countries do have that, you know, UK, Germany, and other countries where the government even pays for private facilities, right?
Yeah.
As long as you can get that. So it will introduce more doctors into the field, more nurses. But I understand your point of view where the con is we might have a lot of nurses or doctors go from public to private, and we might not have some
We've already seen that so
Yeah.
far. We've seen nurses nurses and doctors go to the private facilities there. So we've already seen the effects there. That's why we're having
Yeah.
the shortage right now. So if you're running parallel, you know, obviously money talks.
Yeah.
We are all greedy people in the end of the day. So for
And
all
at
the good they do, the
and at the
doctors and
same
nurses.
time, we don't want the monopoly happening to sort of how right now we have a monopoly in telecommunications, we have a monopoly in the airline industry, we have a monopoly. We don't want to end up that type of monopoly where these bigger companies come in, private, especially private ones, and they just overtake, and then they run the show. So I am definitely not for full privatization. Full privatization. I think it should be half and half or some type of division. But I get your point of view about it will create a division between a poor person getting very basic or no health care, or or having challenges versus somebody wealthy. So it will create a class division.
Yeah, and the other thing is, when the pay is better in private, why should I slave over a government job when I can go into the private field and pay more? And now I know some people say, no, that's not how we are. We are always helpful, and we're not. We pretend we are something, but we're not. In the end, money speaks, because look at the cost of living in Ontario itself, right?
So, I mean, 100%. I think step one would be obviously to, work on our, staff shortages in terms of doctors, nurses, and everything. And if that doesn't work, though, what else can we do, do you think, before going to step two, which is privatization?
To be fair, I think just getting more doctors and nurses should help
resolve the problem.
Because honestly, the government never looks into the future, right? And what exacerbated this whole situation is COVID, right? And it doesn't help that we have conspiracy theories going online saying that this COVID was a control thing. And then these are the people that are causing the wait lines in ER. Because these people didn't want to get the vaccine.
Exactly.
Now, you can be a pro-vaccine, against the vaccine, whatever the case might be, but these people look online and they think they're better than the doctors and nurses that trained for years on how to deal with diseases.
Makes sense.
And we have these people overloading our system, and then nurses and doctors forced to treat these people, and that's probably why they're getting burnt out, because they are seeing that people that didn't care about the other humanity, taking up resources, and people that couldn't get the resources are dying. And that's one situation we're dealing with, is that's why their nurses, doctors are getting burnt out.
So yes, COVID did amplify things, 100%, but even without COVID, let's take COVID out of the equation.
Right.
We were already at a low point. We were already struggling for decades now with shortage of doctors. We were already struggling. So yes, COVID did amplify things, and once and slowly it's being resolved, and we'll get out of this COVID. My question is do you think without COVID we wouldn't be in this issue? I think we would be. We would have been this issue.
So
it might have been in another few years.
It comes back to the point of the government had so much regulations on these foreign doctors and not letting foreign doctors get trained ASAP.
Exactly.
The other problem, like I mentioned before, is the schooling for doctors and nurses. Now, again, the government doesn't have the foresight to see what skilled labor is needed, right? If they were able to say or project, okay, the population is going to increase by 10%, we're going to need another 10% more doctors. This is where they could have gone and said, all right, we need more doctors, nurses. We're going to pay for your schooling, or we're going to give you a discount on something.
Yeah, why not have some grants? So, for example, if for nursing programs, let's say, I'm just giving an example. I don't know what the numbers are, but let's say per semester is $3,000 for tuition fees. Why can't the government cover half? Or at desperate times, even full for those fields? Then you get a lot more, people going for those fields.
Or
right?
you pay for full, and then you have them sign like a 5-year contract. You serve us for 5 years in this province. You do not go to another province.
Yeah,
right.
That's true. That's a good point. Yeah.
This is the thing. We never held the politicians accountable. They're always worried about their seat for next term.
Yeah.
Again, the schools need to have more placement options instead of having like 12 per year.
Yeah, like certain seating requirements. Agreed.
Again,
and there's people leaving from this province going to different provinces because there's not enough seats, as well as doctors and a lot of people in the healthcare industry are leaving to go to the US or other countries, so they can so they can they can get that seat, right? They can get that into
and
the
some of
field.
them go to the States and you get paid more as well, right? Money does talk. So having Bill 124 limit the payment options,
it's frustrating.
It's crazy.
Where a nurse who's in, let's say, Windsor, she might just travel to Detroit for a job back and forth, right? As an example.
And that's the crazy stuff. So I know we were always at a low point with the healthcare, but it was never a top priority till it affected everybody. Right. And this is where I say we should open up more schools or open up the amount of placement options that we have for doctors, nurses, EMS. There shouldn't have been a limit. And I think, honestly, I feel like this is part of the government's way of trying to privatize this. And this was just made it worse by the Ford government. You're limiting the pay for the nurses. Why? Right? 1%. 1% doesn't make sense for the rate of inflation. The more nurses leave, it makes more point for him to say, yes, this makes sense for private healthcare. We can bring in business, whatever the case might be. But honestly, it's just to the detriment of us, everybody involved. And I know last election, not a lot of people went out and voted just because they felt like they had no one to vote for. But that's not an excuse. But coming back to trying to solve this, I think just opening up more spots, training more foreign doctors, letting them do their residency easily. Because I've met people, I remember back in 2007 or 8, I met this cab driver. He was an Iranian doctor, a neurosurgeon. And he was driving a cab, and he said he has to study for 2 years. But at that point, he felt like he was cheated in the way he came here, moved his family here, and he has to study again. And he was an accomplished doctor in Iran. And he was telling me how he was thinking of going back to Iran, even though the government there was not the best for him. But at the end of the day, he needs to feed his family and kids. And why should he slave through studying again when he knows everything? So this is where I feel like there's a disconnect in the government procedures among different departments. If we're scoring certain immigrants on the type of jobs they have, and we're bringing them here, why are we not having another program for them to easily transition through living in Canada? Right? We jump through hoops, and the government easily brings in refugees, provides them everything under the sun, but we don't take care of foreign skilled workers that we desperately need here. right?
Agreed.
So I feel like if we were able to, again, going back to the whole topic of bringing more foreign trained doctors, nurses, and training them up and opening up more class spaces, I think will solve the problem. Obviously, it will take time now because you can't easily just train up someone and they'll know everything. They need to have those years of skills, knowledge imparted on them. But yeah, it's crazy how it's just going downhill, and you know, we need to take care of that.
The other issue I want to talk about, because I want to bring your attention to, is Bill 7, which was known as the More Beds, Better Care Act of 2022, which passed without a public input, about sending seniors to their non-preferred homes without consent, right? You heard about that?
I did, and this brings up the same things that we were talking about.
This leads to that, right? Because we have to make these kind of decisions because we weren't well prepared, because we didn't see, ahead, we weren't proactive. Because of that, we have to, introduce these kind of things where somebody's taking up a bed because there's not enough space in long-term cares, and now.
So just people know what Bill 7 is about. It's basically forcing seniors that are taking up beds in hospitals.
Yeah, let's say they're stabilized, they're waiting for the long-term care.
Yeah, they're waiting for a long-term care of their choice. But now, because we have shortage of ER beds, these seniors that have served this country well, paid their taxes and dues, are now being forced to go to a long-term care of not their choosing. And if they refuse that, they are going to be fined $1,500 a day
or more, based on the hospital.
Based on the hospital. And we've all heard the horror stories about abuse in long-term cares.
Yeah, especially during COVID, that came to light, where a lot of nursing home and retirement homes and long-term cares, they all weren't up to standard, or there was a lot of abuse and a lot of you've heard the horror stories, right?
And still not been fixed. And when, these people that are waiting for the long-term care obviously did their research. Cost is a factor as well. There's a reason they're choosing this, and sometimes the wait list for these long-term care homes is like 12 months to 24 months.
Long. It's
right?
Long, very long. Yeah.
And it's not because they are choosing to wait there. It's just they want to be close to their family, right? So now with this Bill 7, which is, I feel like, it's very un-Canadian, especially here in Ontario. This is passed off in Ontario, but this is very un-Canadian, where we are forcing a senior against their will to go to a long-term care that they don't know about. They have no research. They haven't done research, and you're putting them somewhere that might be at risk. Now, if we're already having long wait times already here in the Greater Toronto area, where are we sending these folks to?
Yeah, I mean, let's say they're in Toronto. The politicians say is 1A is temporary, right, until they get their preferred bed, which could be months, or
which
could
is
be
12 months,
longer,
12 to 24 months. Yeah, it's a long wait.
And then they're saying this tool was already around for a long time, where they could have done this, but it's just they want to go a little further, where they can because there were people in the media were saying that this has been, or some politicians were saying that this has been around for a while, but it wasn't like forced upon or whatnot. But now, to free up some beds, they're doing this. So, again, another issue, which is because of poor planning. Yeah.
It's and people can say, why are they forcing them to, or why are they taking up beds in ER? And sometimes,
or other departments, as well.
Right, and the problem is sometimes they need specialized care. You send the senior back home, and if there's no one to take care of them, then it's they're going to get into some kind of accident. God forbid, it might be something fatal. This now takes up our EMS, because now they have to transport these people back to ER, and it's a whole cycle again. And that's why they're waiting for specialized retirement homes. It's unfortunate it's come to this point. And again, I wish the government had foresight to see this is the baby boomers that's going to retire.
They need more beds.
Obviously, you can't forecast the type of care they might need, but when you're frail and old, you definitely need all the help you can, and it's crazy that it's come to this where you're forcing people against their will.
Yeah, agreed. So especially with baby boomers retiring, I think we definitely need more retirement homes, long-term cares and whatnot. So we definitely need to start working on that. I mean, we should have done that like years ago.
Even
but
Public's PSWs,
Yeah.
we don't have enough PSWs to take care of the
to take
seniors,
care of
right?
them, 100%.
Because PSWs has to do home checks and whatnot, and sometimes even nurses, the personal nurses, to go check on each of these patients at different houses. That's again, shortage of nurses for that as well. So
Agreed.
it's a lot of things happening there where it's a cascading effect where everything's so interlinked. But I think just to fix the one main thing, we need to have more staff, more doctors, more nurses.
That's what it comes down to. I think we need to start from the top. Is obviously start with getting more doctors and more nurses. I think, and working our way down, as well as more. Especially we talked about having more long-term cares and whatnot. That's going to be a need that's coming. So we need to work on that.
It's been crazy, but hopefully we can try to solve things and resolve things and get people together. But so it's been a crazy last few years for sure. And we need to go further. We need to start thinking ahead, and that's a key point. Well, all right, guys, we're coming to an end here, and thank you for listening and watching us here today. The reason we started this podcast is to discuss topics that are affecting us in ways that we never thought about. In this instance, if we don't take an active approach in fixing our healthcare system, there may come a point where the system collapses, and then the doctor has to choose whose life to save.
Yeah, I mean, we all need to do our part as well by getting involved, by having these type of conversations with others and holding our politicians accountable. Talk to your local MP, see what his or her point of view is, and remember that when voting, right? That's key. We need to hold everybody accountable, and especially when our lives are at risk with healthcare.
Yeah. All right, guys. So that's our view. What's your view? Let us know.
All right. See you on the next one.
See you guys.
See ya.
Medical Care Services Ontario has provided this color-coded chart for doctors to help assess a patient's predicted short-term mortality risk, assessing their chances of dying in the next 12 months from non-COVID causes.
So, do they have heart disease? Do they have lung disease, kidney disease? Do they have cancer? How likely are they to survive from their other illnesses and medical problems over the next year?